Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of hot flushes. Hot flushes. First line for hot flushes is hormone replacement therapy. Second line treatment include we can give Tibolon. Tibolon contains estrogen with progesterone. Selective serotonin reuptake inhibitors like fluoxetine can be given. Clonidine, gabapentin, pregabalin, phytoestrogens like non-steroidal plant-derived estrogens, isoflavones, flax seeds can also be given. Selective estrogen the selective estrogen um, reuptake modulators like relaxifin are never used in hot flushes. Recently, FDA approved estrogen with selective estrogen reuptake modulation combination, that is bazidoxin can be given.
thank you and thank you for watching.